I had a patient who had been complaining of noise in her ears and neck pain. She had been doing various exercises and she was performing incorrectly the exercises recommended by other unqualified specialists, which led to muscle spasms in her neck. As a result, she ended up losing hearing in one ear. That's why, friends, it's important to know which exercises you can do and which ones you should avoid. And today in this video, I will be talking about the causes of ringing in the ears because this issue troubles many people. There are various reasons why ringing in the ears can occur. Today, I will give you recommendations and safe techniques that can help you reduce the ringing in your ears. So ringing in the ears refers to any sound, whistling, ringing, hissing or humming that occurs without an external sound source. Medically, it is called tinnitus, and it can be either temporary or chronic. Tinnitus can be divided into two categories: vascular noise and neurological noise, the latter being associated with serious neurological issues. Vascular noise can arise for various reasons. First of all, how can it be diagnosed? Very easily. Vascular noise can occur without any prior issues such as ear trauma, head injuries, headaches, and so on. In other words, none of these problems were present, yet a ringing sound may appear in one or quite often in both ears at once. If this noise is connected to your pulse, that is, you feel a reaction corresponding to your heartbeat, if you listen closely to your pulse and notice that the noise or ringing is synchronized with it, then it is related to a vascular origin. And especially in people with high blood pressure or hypertension, particularly during a hypertensive crisis, this ringing or noise can intensify significantly. Additionally, impaired venous outflow can also contribute. We have blood vessels that supply the brain, and there are also vessels that pass out of the skull to facilitate fluid drainage. So, if a lot of fluid accumulates in the vessels of the head and cannot drain properly, it leads to venous congestion. This also causes the appearance of noise, that is, ringing in the ears. It also manifests in such a way that during physical exertion, especially if you lower your head down, keep it down for a while, or engage in intense physical activity, the ringing in your ears can become more pronounced. Physical exertion increases the ringing in the ears. This is the second symptom associated with vascular causes. Thirdly, it can also be related to stress. As you know, stress raises blood pressure, meaning the blood vessels constrict, and therefore, if you experience ringing in your ears after a significant stressful event, it is also most likely related to vascular causes. With the help of these symptoms, you can determine whether the noise is vascular in origin or not. And vascular noise can be effectively treated, and it is even possible to get rid of it completely. There is also another type of noise, which I forgot to mention, related to neck tension. You see, these blood vessels pass through the vertebrae, so cervical osteochondrosis, herniated discs, and certain neck spasms, especially in the occipital area, can lead to the appearance of noise in the ears. This will also be related to the vascular factor, and by working on the neck, you can also eliminate the noise in your ears. The next category is noise associated with neurological problems. This is related to cases where a person has had either a traumatic brain injury or an ear injury, for example, from deep diving. If there was severe pain and inflammation after the injury, it could indicate that there was direct damage to the inner ear, specifically the cochlea. And when the cells die, they can produce a kind of squealing sound. This type of noise is characterized by its constancy. Pressure, physical exertion, and even stress do not affect this noise. In other words, this noise is constant, and usually only one ear is affected, either the left or the right, depending on the site of the damage. This type of noise is very difficult to influence. It is only possible to intervene at the early stages, when the damage has occurred, but the nerve cells of the auditory system have not yet died and can still be restored. In other words, at the early stages, recovery is possible. But if there was trauma or some kind of damage and many years have passed, unfortunately, it is often no longer possible to influence this noise. There is also a neurological category of tinnitus that serves as a precursor to migraines. Before a severe headache attack, when the head feels like it's splitting, changes in vision, dizziness, or an increase in noise can occur. In other words, it acts as a warning sign of an impending migraine attack. So if it is associated with migraines, you need to treat the migraine itself, and then you will be able to address the noise as well. In general, neurological symptoms are difficult to correct, while vascular ones are easier. Now, I will show you an exercise that can help you get rid of tinnitus. Here we have the outer ear. Next comes the middle ear, and right here is the cochlea. It is precisely in this area, right here, that the ringing appears. When these nerves are affected, the ringing occurs. And this snail is located deep in the bones. right here, just behind the ear, inside these bones. I'm showing you this so that you understand at what depth you need to work, because the techniques I'm demonstrating will directly affect the ear. The first technique, we need to improve blood drainage and circulation in this area. There is a universal technique. You take this muscle, the sternocleidomastoid muscle, you grab it, and then with your other hand you grasp over the top of the ear like this. In other words, you are grabbing the bone along with the cochlea and gently pulling, performing these kinds of stretches. Simply do about 30 tilts to one side like this. Just gently stretch. You can also add breathing, inhale, exhale. When you perform this technique, you'll feel a sense of relaxation. You'll notice clarity and lightness in your head. And most importantly, these techniques are safe because they are aimed at relaxing the blood vessels and improving blood circulation. Because if you do it incorrectly, if you focus on straining, like one of my patients did, she was strengthening her neck muscles by pressing the back of her head against the wall. And this led to a spasm that affected the blood vessels and the vertebral artery. As a result, she developed severe ear pain and even lost hearing in one ear due to improper exercise execution. That's why it's very important to pay attention to what other exercises you are doing. Now let's move on to the next technique. And what do you need to do? We take a grip, stretch it out to the sides and start making circular movements. Just do it for about a minute. While maintaining the stretch, don't forget to breathe. Inhale and exhale. Relax, turn your head. That is, not with your hands, but with your head. This technique, it is great. This technique works. You can also combine it further by repeating this. Technique for stretching the blood vessels and muscles. By practicing these techniques daily over an extended period, you will notice that not only will the ringing in your ears disappear, but your hearing acuity will also improve. Please write in the comments what you feel after performing the techniques. Do you feel warmth, relaxation? Maybe you already felt right now that the ringing in your ears has lessened or your hearing acuity has improved. As you can see, I have many useful exercises and I add new videos every week with useful exercises for addressing all kinds of issues in our body, how to work with our internal organs, how to work with the musculoskeletal system, and so on. That's why I highly recommend subscribing to my YouTube channel. This was Dr. Als with you. See you next time.